afternoon, everyone. Welcome to Cat's Cauldron, a show where you have a voice and we stir it up a bit. Let me remind you that our stated days for certain topics is Manic Mondays on Monday. Tuesday is Titillating Rant. Wednesday, Paranormal Curses and the Unknown. Thursday, Veteran Topics. Friday, TGIF, anything goes. Let me also remind you that you can actually write me in. You can answer and comment to any of the posts on Instagram, Facebook, and some of the other social medias, Getter, that you want to. And just comment and let me know if there's something you're really interested in talking about. So, and I'd be happy to entertain that with you. Tonight, we're going to talk about drugs and addiction. I will have another segment, not tomorrow, but I will have another segment on it, enhancing some information, and I will have some people that I have asked, and we've talked about interviewing. So that will be some exciting time and a different topic, and I'll have some guests. So, approximately 40,000 Americans die every year with toxic levels of opioids in their body. A crisis exacerbated by a hard-to-detect synthetic version of the drug that experts warn is flooding the market and rapidly making its way into the hands of unsuspecting users. Many of them are youth. Fentanyl. It is 80 to 100 times stronger than morphine, has become the leading cause of overdose death in America, along with other synthetic opioids, according to the National Institute on Drug Abuse. Naloxone is a medication that can temporarily reverse the effects of the opioids if administered quickly enough, and it's been distributed to patients using opioids for pain relief. What's being done about it? Well, the Biden administration is doling out $30 million worth of grant money to communities across the country to confront the overdose epidemic, first day with my new mouth, which has been exacerbated by the COVID pandemic as well. The initiative from the HHS plans to provide naloxone, fentanyl test strips, and clean syringes, as well as go after violent criminals who are trafficking illicit drugs like fentanyl across the U.S. borders and into local communities. Part of the $30 million in grant is going to an initiative. This initiative will include safe smoking kit. Well, if you're like me, I asked, what is a safe smoking kit? I had never heard of such a thing. Help me out here and explain exactly what is in this kit and why do we need it. I'd also like to know what's in the kit because our tax dollars is paying for this. So it would be really nice if we could understand what's going out there and whose hands it's going into. Marco Rubio posted a 30-second video denouncing the Biden administration, claiming the White House plan would send pipes into underserved communities. I know that sounds insane. I know that sounds crazy to be true. They confirmed it yesterday. They call them smoking kits and say it's about equity, Rubio says. But they have in essence confirmed that they are going to be mailing and sending pipes that can be used to smoke crack and meth to underserved communities in America. Rubio doesn't want taxpayer money used by nonprofit agencies without guardrails. He and Senator Rick Scott of Florida and 14 others filed a bill to prohibit any money in the American Rescue Plan from purchasing, supplying, or distributing crack pipes or similar drug paraphernalia. The Health and Human Services Department has nearly $30 million planned. Let's try this again for stay with my new mouth. The Health and Human Services Department has a nearly $30 million plan called the Harm Reduction Plan. Critics claim it will distribute pipes for established centers where addicts could legally use drugs that are otherwise illegal and use them under medical observation or care. Is this true? The White House says no. Okay, I am going to show you Jack's 4 News' transcript on this instead of just reading the transcripts to you. That way you can see that I got it from a real news source. So stand by.
2 U.S. senators are moving quickly, filing a bill they call the Crack Act. They have cause for concern. It comes from the White House plan trying to fight the opioid epidemic. Critics say the federal government is funding crack pipes. We put that claim through our trust index.
This is insanity. This isn't even about liberal and conservative anymore. This is about crazy versus normal, insane versus common sense. Where does this end?
Florida's Marco Rubio posted a 30-second video denouncing the Biden administration, claiming the White House plan would send crack pipes into underserved communities.
I know that sounds insane. I know that sounds too crazy to be true. They confirmed it yesterday. They call them smoking kits, and they say it's about equity, but they have in essence confirmed that they're going to be mailing and sending pipes that can be used to smoke crack and meth to underserved communities in America.
Rubio doesn't want taxpayer money used by nonprofit agencies without guardrails. He and Senator Rick Scott and 14 others filed a bill to prohibit any money in the American Rescue Plan from purchasing, supplying, or distributing crack pipes or similar drug paraphernalia. The Health and Human Services Department has a nearly $30 million plan called the Harm Reduction Program. Critics claim it will distribute crack pipes or establish centers where addicts could legally use drugs that are otherwise illegal and use them under medical observation or care. Is that true? The White House says no. We pulled the transcript of Press Secretary Jen Psaki in a briefing Tuesday. She was asked if crack pipes were going to be part of the safe smoking kits of the program, and she said they were never a part of the kit. It was inaccurate reporting. When asked what is in the safe smoking kit, President Biden's spokesperson said this.
The safe smoking kit may contain alcohol swabs, lip balm, other materials to promote hygiene and reduce the transmission of diseases like HIV and hepatitis. I would note that what we're really talking about here is steps that we're taking as a federal government to address the opioid epidemic, which is killing tens of thousands, if not more, Americans every single day, week, month of the year.
Conservative lawmakers across the country have jumped on the claim about crack pipe distribution. The HHS denies the claim, calling it blatant misinformation. The Substance Abuse and Mental Health Services Administration wrote in a statement to Fox News that the Harm Reduction Grant is a grant program designed to help Americans who are struggling with substance use stay healthy and safe, prevent overdose death, and find pathways into evidence-based treatments. The American Medical Association endorses harm reduction measures like safe syringe exchanges and drug testing kits. Wednesday, the HHS sent out a release saying no federal funding will be used directly or through subsequent reimbursement of grantees to put pipes in safe smoking kits. The goal of harm reduction is to save lives. The need for something to fight back against the opioid epidemic is clear. Just under 7.5% of every overdose death in the country happens in Florida. The death rate for overdoses is 23% higher than the national rate. Questions on this topic, though, remain, including if the kits may have initially intended to include pipes or if they may include something not commonly referred to as a crack pipe. As noted in a report by the Washington Post on Wednesday, HHS did not answer a question from the Post about whether the kits could include glass stems. And so because of that, we rate this claim, be careful. The Trust Index team fact checks questionable information circulating on social media and in our communities. And you can head to this section on our website, news4jax.com, to see more about the News4Jax Trust Index and to suggest a claim we should investigate.
So the Substance Abuse and Mental Health Services Administration read a statement to Fox News that the Harm Reduction Grant is a grant program designed to help Americans who are struggling with substance abuse stay healthy and safe, prevent overdose death, and find pathways into evidence-based treatments. The American Medical Association endorses the harm reduction measures like safe syringes, exchange, and drug testing kits. Cassandra Frederick, Executive Director of the Drug Policy Alliance, issued a response that the Alliance said is to the HHS and Office of the National Drug Policy Statement that they will no longer be allowing federal funding to go towards putting pipes in safer smoking supplies. The response reads in part, backtracking on providing critical evidence-based resources that greatly improve the health of people who consume drugs through smoking is a huge missed opportunity that will disproportionately be felt in Black and Indigenous communities, especially as these communities have experienced some of the sharpest increases in overdose deaths involving fentanyl, cocaine, and methamphetamines. It adds, harm reduction works to meet people where they are at and keep people free of disease and alive so that they have a chance of recovery and healing. We applaud the Biden administration for the steps they have taken to advance harm reduction and advocate for the funding needed to supply needed resources and save lives. But they must stand firm against misinformation and continue the course to deploy all evidence-based solutions, including all forms of safer smoking supplies to save lives. Wednesday, the HHS sent out a release saying no federal funding will be used directly or through subsequent reimbursement of grantees to put pipes in safe smoking kits. The goal of harm reduction is to save lives. The need for something to fight back against opioid epidemic is clear. And again, you heard the anchor state that there's like 7.5% of every overdose death in the country happens in Florida. The death rate for overdoses is 23% higher than the national rate. It also has to do with the amount of veterans you have here and the pain that they are suffering. The question of does a White House plan to battle the opioid epidemic involve sending smoking kits that contain pipes into underserved communities? The question still remains, including if kits may have initially intended to include pipes or if they may include something not commonly referred to as a crack pipe. As noted in a report by the Washington Post on Wednesday, HHS did not answer the question from the Post about whether the kits would include glass stems. I'm not telling you what to think. I'm not telling you what to believe. I'm just reading it as the report came out. You decide what to believe. I don't know. I can't tell you one way or the other. I'm not putting the kits together, so I can't tell you one way or the other. But it would be great to know where the funding is going to and what communities, how it's going to help them, and it needs to be regulated and monitored very heavily, no matter what it includes. But it would be nice to know what it does include. So, as always, you can find me on Spreaker, YouTube, Anchor, Google Podcasts, Facebook, Reddit, Instagram, iHeartRadio,